Hey guys, so today's video is going to be a little different. I'm starting this online question series where we go through a question together that I've made, and then we're going to discuss each of the answer choices. I'm trying to make these questions as high yield as possible, and in the answer discussion we're going to go through each of the answer choices and I'll try to describe them a little bit to you. These are topics that I remember I had a little bit of trouble with studying for my CK, so hopefully these topics will help you. And I've tried to include high yield images as well so that you can get the full experience. So this is our first case. Hopefully it's one of many. So we have an 18-year-old boy, okay? He comes into the ED for swelling of his right periorbital region. Yesterday he woke up with a painful, warm, soft lump on the right eyelid, okay? Eye movement does not increase pain. Okay, that's important to know. Physical exam shows redness and swelling of the upper eyelid and involvement of the hair follicles. On palpation, the swelling drains purulent fluid. Which of the following is the most likely diagnosis? So in order to diagnose this patient, I'll give you a couple seconds to think about the answer choice. You can pause the video now if you'd like, and then we're going to be going through them together. Okay, so here on the bottom I've included a picture of what this condition looks like. This is the patient's left eye, and on the stem it says right, but let's just imagine this is on the right. Okay, so if you picked answer choice A, you are correct. So let's go through each of the answer choices together and discuss them and why each is right or wrong. So let's go with answer choice A first. All right, so hordeolium. A hordeolium is two things. It's acute and it's purulent. Okay, in our question stem, our patient had an acute purulent mass. All right, so that's a really good indicator for hordeolium. It basically allows you to snipe the answer. What it causes hordeolium? So Staphylococcus aureus is the main culprit here, and it comes in two flavors, an external and internal version. Okay, so let's have a bit of a discussion about what these are so you can impress your attending with your knowledge. All right, so an external hordeolium is also known as a STI. It infects two glands in the eye, the glands of Mole and the glands of Zeiss. So here I've included a little diagram on the right with the glands of Mole and Zeiss. If we look at this zoomed in section here, here are the glands of Zeiss, here are the glands of Mole. And what exactly are they? So they're both attached to the hair follicle. The glands of Mole are apocrine sweat glands, so they produce sweat just like all the hairy areas in your body with apocrine glands. And the glands of Zeiss are sebaceous glands, which basically produce sebum to protect the hair of the eyelash. Okay, so those get infected in external hordeolium. Internal hordeolium affects the meibomian gland. Now this is a lot more rare, so a lot of people associate hordeolium with the meibomian gland, even though it's a lot more rare than Mole and Zeiss. Okay, so just know that. And it also affects the palpebral conjunctiva. So here we have the meibomian gland. All right, it's in this area right here. It's this yellow structure. It produces something called meibum. Meibum prevents the eyelid, the conjunctiva, from essentially evaporating all of the tears. Okay, it's kind of helps to retain moisture in the eye. Okay, and so hordeoliums usually don't last that long. They usually resolve within 1 to 2 weeks, and treatment for the most part is usually conservative, so warm compress. As you'll see with a lot of these eye conditions, warm compress is usually first line for many of these, and if it's recurrent or it persists or it's very severe, then you can do something like incision and curettage to kind of drain all that pussy fluid out. All right, so we've discussed hordeolium, the right answer. Now let's keep going. Let's go with the next answer, Dacrosysttitis. Okay, so what is Dacrosysttitis? What are the properties of Dacrosysttitis? Dacrosysttitis has erythema, edema, warmth, purulent drainage, and pain. These are all things that we saw with our hordeolium. Okay, so why is this answer choice wrong? So what Dacrosysttitis is essentially an inflammation of the lacrimal sac. That's the medial sac right here beside the eye. Now our patient, he didn't have a medial bump. He had a bump, where was it? On the right eyelid, okay? If this bump would essentially have to be over here in order for us to put Dacrosysttitis higher on the differential. All right, and this arises from the lacrimal sac below the medial canthus of the eye. All right. It's acute, it can be congenital or acquired. Let's say you have an injury where these ducts get damaged in any way, like someone punches you in the face or something like that, and you can have tear duct stasis. This then gets infected, and you have Dacrosysttitis. Staph and strep are our main culprits for this condition. And I've included a couple of pictures here. So as you can see, Dacrosysttitis, these are more medial lesions, okay? And here's our hordeolum. So this is not Dacrosysttitis over here on the right. This is just comparing a lower lid Dacrosysttitis versus a lower lid hordeolum. So here's the H, hordiolium, and here's the D for Dacrosysttitis. Just compare their locations, all right? So this is one of the main differentiators. Other than that, they're very similar, as we've seen before. We have erythema, edema, warmth, purulent drainage. All of them share characteristics, okay? So just watch out with positioning here. That'll differentiate it for you. Next, we have blepharitis. So blepharitis, we have essentially inflammation of the eyelid. It's red, swollen eyelids with crusty, scaly plaques and oily deposits. So this is a very classic picture over here on the right. You'll see the crusty, scaly plaques on the eyelid. And usually these people will have a lot of tearing as well. So essentially these are associated with chronic, recurrent symptoms of inflammation. Our patient, remember, had an acute case. So if someone comes in with blepharitis, most likely they've had it before, and it's an ongoing problem. It also involves bilateral eyelids. So our guy had a unilateral problem. Blepharitis is a bilateral problem. Then we have excessive tearing and foreign body sensation. Foreign body sensation is one of those keywords where you can essentially snipe this answer. So just watch out for this terminology, foreign body sensation, because the eye is really inflamed and can feel dry. In contrast, this patient presents with acute unilateral symptoms, right? So this is not what our patient has. It's caused by staph, it can be caused by herpes simplex and varicella. These things can infect the blephara and essentially irritate them. It's also associated with allergies, tear duct obstruction, and Sjogren's syndrome. So watch out for these associations on the test. And it also comes in two flavors, just like our hordeolum. So that's the anterior flavor and the posterior flavor. Anterior blepharitis is the anterior margin of the eyelid involving the skin, eyelashes, and follicles. And posterior is inflammation of the posterior margin associated with meibomian gland dysfunction and obstruction, also known as meibomitis. And so I've included a kind of two pictures here for you to consider. So here we have more of an anterior picture, and here we have more of a posterior picture. So notice how the whole eyelid is inflamed. We don't just have a cyst-looking picture like with our hordeolum over here. This whole eyelid is red, crusty, and inflamed. So that's blepharitis. Next, we have Xanthelasma. Now, this one should have been an easy to rule out thing. Xanthelasma is also usually bilateral. These are cholesterol-filled soft yellow plaques, which usually appear medially on the eye. So look at these medial lesions right here. Boom, boom. These are not painful, right? And they're essentially made of LDL, or lipid deposits. They're associated with diabetes and hyperlipidemia. There's no purulence, no pain, and no erythema. So our patient had all those three, so this can instantly be ruled out. Now, when you see these cholesterol deposits, you want to look for cholesterol deposits elsewhere in the body. So here's some more for you. These are on the skin. And so just make sure you take an LDL panel. This person might need to go on a statin. They might have a congenital condition, so watch out for that. Next, let's go over our other main culprits. So hordeolum and Chalazion are kind of your two main differentiators you're taught in med school. But Chalazion is easy to differentiate. So before I learned about this, it was a little bit of a coin toss which one I would pick, but very easy to differentiate between the two. So you can see over here on the picture on the right, they kind of look the same, right? We have this unilateral cyst on one of the eyelids. It can be on the top or the bottom, doesn't matter. But this is a nodule that is slowly progressing, firm, rubbery, non-purulent, non-tender, okay? So our hordeolum is aggressive, it's purulent, it drains, it's painful. This one, slow growing, so it's not acute, it's more of a chronic thing. It's painless, it's rubbery. The patient sometimes just comes in because they start feeling heaviness in the eyelid, all right? So it's going to weigh down that eyelid. It's a granulomatous swelling of the sebaceous glands. So that can either be our meibomian or our Zeiss, like we talked about. These both are sebaceous. And it presents with eyelid heaviness. If it's persistent, one important clinical feature is that you have to check for sebaceous carcinoma. So if they keep getting this over and over again, maybe you've done an incision drainage, maybe you've cut it out, and it comes back, then you have to check for meibomian carcinoma, essentially, sebaceous carcinoma. So if these things last for more than 2-3 weeks, you might want to consider getting a biopsy of it just to double check. All right. So again, with this, you want to do warm compress. Similar with blepharitis, the first initial treatment is warm compress, and then you can move on to things like steroids for blepharitis. You can move on to a biopsy for Chalazion, right? Xanthelasma, you want to treat the high LDL, and hordiolium, again, you can do curettage, incision, and drainage for them. All right, so I hope this case and these pictures helped you out, and I look forward to doing more of these in the future if you guys like them. And it also helps me review, so it's a good thing for both of us. Thanks for watching, and I'll see you in the next video.